Yeah, so it was the summer of 1998, and we were on our way to visit some friends over in Europe, and we were on our way to the airport, and my brother and I thought we had left our epinephrine auto-injector at home. A discussion ensued, and in fact, our oldest brother was like, well, Evan, you're going into engineering, and Eric, you're going into medical school. Why don't you guys just invent something different? From that point on, we were jotting down on napkins different sketches of what it could look like. So we always wanted to be kind of that credit card size design. The automatic retractable needle was something that was, from the get-go, one of our ideas that we included as a part of the design. And that's where the journey began.
Indication. Auvi-Q epinephrine injection USP is indicated in the emergency treatment of allergic reactions, type 1, including anaphylaxis to allergens, idiopathic and exercise-induced anaphylaxis. Auvi-Q is intended for patients with a history of anaphylactic reactions or who are at risk for anaphylaxis. Important safety information. Auvi-Q is intended for immediate self-administration as emergency supportive therapy only and is not a substitute for immediate medical care. In conjunction with the administration of epinephrine, the patient should seek immediate medical or hospital care. More than 2 sequential doses of epinephrine should only be administered under direct medical supervision. Auvi-Q should only be injected into the anterolateral aspect of the thigh. Do not inject intravenously or into buttock, digits, hands, or feet. Instruct caregivers to hold the leg of young children firmly in place and limit movement prior to and during injection to minimize the risk of injection-related injury. Rare cases of serious skin and soft tissue infections have been reported following epinephrine injection. Advise patients to seek medical care if they develop any of the following symptoms at an injection site: redness that does not go away, swelling, tenderness, or the area feels warm to the touch. Epinephrine should be administered with caution to patients with certain heart diseases and in patients who are on medications that may sensitize the heart to arrhythmias, because it may precipitate or aggravate angina pectoris and produce ventricular arrhythmias. Arrhythmias, including fatal ventricular fibrillation, have been reported in patients with underlying cardiac disease or taking cardiac glycosides or diuretics. Patients with certain medical conditions or who take certain medications for allergies, depression, thyroid disorders, diabetes, and hypertension may be at greater risk for adverse reactions. Common adverse reactions to epinephrine include anxiety, apprehensiveness, restlessness, tremor, weakness, dizziness, sweating, palpitations, pallor, nausea and vomiting, headache, and/or respiratory difficulties. Please see the full prescribing information and patient information at www.auvi-q.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.